Hello everyone, welcome back to Microbiome Solutions. Today we are discussing about laboratory diagnosis of HIV infection. There are different types of tests available for the lab diagnosis of HIV. One such as specific test and the other is non-specific or immunological test. So the non-specific test includes total leukocyte count or total lymphocyte count, which is done to demonstrate leukopenia and lymphocytopenia. Usually lymphocyte count you seen below 2000 millimeter cube. And the next test is T cell subset assay, where absolute CD4 plus T cell count will be less than 200 millimeter cube. And platelet will show thrombocytopenia, that is reduced platelet count, and lymph node biopsy shows profound abnormalities. Moving on to the specific test for HIV infection, it could be antibody or antigen detection. Both the specific and non-specific tests, we use a blood sample. For the specific test, 2 to 8 weeks, 2 months for the appearance of antibodies. During this period, the individual is highly infectious and this stage is called as window period. So from 2 to 8 weeks, 2 months, that is the window period for the appearance of antibodies. Infection can be detected during this window period by P24 antigen ELISA, RNA RT-PCR and DNA PCR. If you have seen the previous video where I was describing the morphology of HIV virus, so in that you could see that there are different antigens seen in the HIV virus. One such antigen is P24, which can be detected using ELISA. And the serological test includes two types of serological tests. First one is screening test and the next one is confirmatory test. Screening test is ELISA test, it is enzyme linked immunosorbent assay. So here for ELISA, antigen is obtained by recombinant technique. Antigen is obtained by a recombinant DNA technology and which is coated on microtiter well. And the test serum is added, and if there is any antibody present, it will bind to the antigen. So the antigen is coated on a microtiter well, and when the patient sample is added, if it contains any antibody, it will bind to the antigen to form an antigen antibody complex. This serum plus antigen will be subjected to washing, and after washing, anti-human immunoglobulin, which is linked to a suitable enzyme, is added, which is followed by a color forming substrate addition, and this can be read by a special ELISA reader. So at the end of this reaction, a stop solution is added and there will be a colored end product formation. This colored end product can be read by a special ELISA reader. And next is a rapid test, that is immunochromatography or TriDot test, and the confirmatory test for HIV is Western blot assay. So you can see this is the Western blot assay paper what you are seeing. First one you can check it as a controlled Western blot paper, and this is positive control, I would say positive control, and the second one is the test and the third one is a negative. So negative control also I cannot say that it doesn't have any bands at all. So these are the antigens and glycoproteins seen in HIV virus, namely P15, P17, P24, P31, GP41, P51, P55, P66, GP120 and GP160. So you will have a control running parallelly to your test, and if any of these bands are coming, the subsequent bands, see you can see here GP160 has got a band, GP120 has also got a band, and P66, P55, P51, P31 and P24 also has got a band. So it would suggest that your test is positive for HIV. So this is how you do a confirmatory test, that is a Western blot test. And next for the antigen detection, virus core antigen, that is P24, is the earliest viral marker, may be detectable in blood after 2 weeks of infection. And the free P24 antigen disappears from the circulation and remains absent during long asymptomatic phase. When we were discussing about the different phases of HIV, there was an asymptomatic phase. P24 antigen will disappear during the asymptomatic phase and will reappear only when the severe clinical disease sets in. That is, it could be a persistent generalized lymphadenopathy or AIDS-related complex. P24 antigen ELISA can be done at this stage, which will be positive in first few weeks and in terminal illness. Next is isolation of virus. HIV can be isolated as it is present in circulation and in body fluids within lymphocytes and cells free. The virus can be isolated from peripheral lymphocyte by co-cultivation with normal lymphocytes in the presence of interleukin 2. And viral replication is demonstrated by reverse transcriptase activity and presence of P24 antigen. And PCR assay is the gold standard test for diagnosis of all stages of HIV infection. There are two types of PCR available. First one is DNA PCR, and which detects the HIV pro-viral DNA in peripheral lymphocytes. Next is RNA PCR, will help in diagnosing and monitoring the level of viremia in blood and gives the number of viral RNA copies per ml, or it will help us to determine the viral load. So this is about today's lecture. If you have any doubts, please post it in the comment section. Please do like, share and subscribe to our channel. Thank you.